Hi, wonderful people. This is Abby, and thank you so much. We are in a new week, and I hope we all have a blessed week. Okay, so I am about to start a spring semester. So, those of you who do not know me, let me do a quick introduction. My name is Abby. I am a trauma nurse. I am also a nurse administrator, and I'm a clinical instructor in an RN program. So we had a faculty meeting and spring semester is about to start. And we have our expectations as a clinical instructors. Today, I want to give some tips for a successful clinical rotation. I know when a new clinical rotation is about to start, students freak out. How am I going to be successful? How am I going to come out of this clinical successful and be satisfactory in my clinicals? And so I have some tips that I believe helped me when I was in nursing school, and it's going to help someone. So if it helps one person, I always say, if my video helps one person, I think I am okay with that. Let's talk about some tips that will help students have a successful rotation. First tip is to have a good night's sleep. You don't want to go to clinicals when you're not well rested. So please have a good night's sleep, get well rested so that you can take care of your patients. Taking care of you starts from nursing school. It starts from any time, but nursing school, when you're a student, you have to learn, you have to adjust your time to be able to take care of yourself. And taking care of you is very important for you to have a successful clinical and also be successful in your course. So yes, have a good night's sleep. The second one is be prepared. Being prepared is being on time, dressed appropriately, dress like you should, and showing up on time. So that is how you get prepared, having all your books, everything that you need to take with you to clinicals, having that, preparing that prior to going for clinicals. So when you get going, you know that you have everything with you. You have your stethoscope, you have your blood pressure cuff, you have everything that you need for your clinicals. My third one will be to be an active listener. So listen to your clinical instructor, listen to the assignments when we are giving you a report on your patient. Listening to the nurses who have been assigned, the primary care nurses for the patient that you're going to be assigned to. You have to listen to the nurses. So when they give you instruction, calming down and listening to whatever you're being told is very important. My fourth one will be to ask questions. It is very important to ask questions. Asking your clinical instructor questions. I always tell my students and also nurses that I present that in this business, once you stop asking questions, you are going to fail, because then you feel like you know it all and you got it. With any shred of doubt, you ask questions. Nurse managers ask questions, charge nurses ask questions, because we don't have it all. We do not have all the answers. So asking questions, because there's a question that you might ask me and I wouldn't know it. I'll ask my other colleague, and I can ask a new grad nurse who have that information. So, and no question is a stupid question. Ask question, ask your clinical instructor, ask your the nurse for the patient, ask your colleagues, ask your fellow students. They will be having the answer to a question that you might have. So do not think that, oh, if I ask a question, I'm going to look stupid. No, please ask questions and get the right information so that you can take care of your patient really well. My next one is gracefully accepting feedback. We all need the feedback in our life. when we're doing something, we expect that someone watching us will give us feedback, whether good or bad. You take it in good stride and make changes. You will have your nurses and the nurses on the unit giving feedback. You have your clinical instructor especially giving you feedback that, hey, you did it this way, you might want to take a look at it this other way. That will help. Even as a clinical instructor, I learn every day. I don't know it all. No, I do not know it all. I learn from my students. I learn from fellow nurses. I learn from everywhere. I draw inspiration. I draw knowledge from everywhere that I could. So it is very important to gracefully accept feedback and make the necessary changes, because as a student, you'll be getting that a lot. You don't know. That's why you're in school, right? Accepting feedback will also help very well. So my next one will be letting go. Letting go in a sense that you don't have to be perfect. I know that no one is perfect helps in this profession. So you are not perfect, and it comes down to asking questions. When you know that you're not perfect, you'll be able to ask questions. So let go of being a perfect person and just learning the job, learning what you have to do as a nurse. Learning. So if you're someone who, everybody wants to be a perfect person, but in this job you strive for perfection, but you don't get entangled in it. Yes, you need so much that you beat yourself up in everything that you do. It is good to strive for perfection, but it gets very dangerous when that is your main goal. I want to be perfect. I have to be perfect in IVs. And so when you are not able to get an IV, you beat yourself out. It just messes your whole mood because you couldn't get an IV. You don't do that in this job. It's okay if you don't get an IV access. It is fine. It took me a long time to be able to be comfortable with doing IV. So let go of being a perfect person and just strive to do your best in this job. But you want to get most of the things right, and also identify when you're not getting something right and asking questions and seeking for help. So hey, can you help me with this? Can you help? That goes a long way, because this job is teamwork. If you don't know how to be a team player, you can be an nurse. So teamwork is very important. My final tip, which is very important, and in some way it's close to letting go of perfection. Relax. No one wants to be around someone who is tense. So relax and trust the process. Trust that what you can do in your first clinical rotation will be different and trust that by the time you get to the end of your rotation, you'll be a better person. You'll be a better nurse. So relax. Do not stress yourself too much. Relax, go into clinicals and just give out your best. And when you make a mistake, let your clinical instructor know. So I hope this helped. These are some of the tips that helped me when I was a student. It did not come just like that. It took time, it took practice, and it took reassurance from my clinical instructors, from my fellow students, and from nurses that I used to work with and nurses that I looked up to. So please relax, chill out, and have a successful spring semester. And thank you for watching this video. I hope you like it, and watch out for more videos. Bye. My name is Abby, and I'll see you in my next video.